Good morning and welcome. I'm Trudy Marotta, a volunteer community ambassador with AARP Virginia. I want to welcome you to our Prepare to Care, Finding Answers, Support, and Resources for Caregiving webinar this morning, and thank you for joining us. AARP is striving to make it easier for older people to live independently and remain in their homes and communities where they prefer to be surrounded by family and friends. By providing planning resources and additional forms of support to family caregivers, AARP hopes to create a country where people can continue to live in their homes and communities for as long as they choose. To help achieve this, AARP is supporting the millions of family caregivers who provide unpaid care to their loved ones and resources and tools, and advocating for, as well as providing better quality, affordable, and accessible services to help older people live independently and the family caregivers who help them. Caregiving can be an all-consuming experience that leaves the caregiver exhausted and lonely, but it can also be an enormously meaningful accomplishment. Half of the caregivers, about 51%, feel their role gives them a sense of purpose or meaning in life. Family and friends are the backbones of America's care system, providing the bulk of care for older people in the US as they strive to live independently. So we at AARP applaud you for deciding to spend time with us this Saturday morning to find answers, support, and resources to help you on your caregiving journey. In the reminder email for today's session, we included a link to download the slide presentation and a link to the resource page listing all the websites that we'll talk about this morning. Today we have Nakia Speller with Prince William County Area Agency on Aging and Keisha Jackson with AARP Virginia. And now onto the program. I'm thrilled to be joined this morning by Keisha Jackson. Like me, Keisha is an AARP Virginia volunteer community ambassador, and we're very fortunate to have her on our team. Keisha is a retired Air Force veteran, creative writer, storyteller, family caregiver, and founder of Encouraging Stories LLC, an online multimedia hub that provides encouraging, entertaining, and educational content to family caregivers. So please give a warm Zoom welcome to Keisha Jackson.
Thanks, Trudy. Thanks a lot. Well, good morning, everyone, and welcome. As Trudy mentioned, my name is Keisha Jackson, and I'm a Northern Virginia community outreach volunteer with AARP. I look forward to facilitating today's conversation. Today's discussion is all about supporting you and your loved ones. I invite you to share ideas, ask questions, and connect with other family caregivers, people just like you. Let's get started. Caring for a family member or a close friend is one of the most important roles you'll play. It may start with driving your loved one to get groceries or going to the doctor. As time goes by, you may find yourself taking more time off from work, preparing meals, or handling bills. No matter where you are in the journey of family caregiving, whether just beginning to anticipate a need, helping to coordinate a big move, or taking care of a family member full-time, having a good framework to help guide both you and your loved one will make the process easier. During this session, we will share a framework to help you make plans to care for family members, neighbors, and friends. You will have opportunity to connect with other family caregivers, exchange tips and advice, and learn about the resources available to you and your loved one. Let's start by taking a multiple choice poll. Select how many of these items you have done.
Your choices this morning are helped a loved one with household tasks, such as cleaning, laundry, or yard work, help a loved one with medications, regularly cook or provide food for a loved one, drive to doctor's appointments, make shopping trips or other errands, provide personal care such as bathing or dressing, help a loved one with finances or paying their bills, provide emotional support and companionship, communicate with health professionals and coordinate healthcare, all of the above and more. And Keisha, in looking at the poll, all of our audience members pretty much provide all of the above and more.
Yeah, you can see from the poll alone that caregiving may be one of the most important roles you will take on in your life. AARP's founder, Dr. Ethel Percy Andrews, was a caregiver to her parents. In fact, she left her job to care for her mother. She said, "It is only in the giving of oneself to others that we truly live. The human contribution is the essential ingredient." Dr. Andrews was an educator, and her passion was to help older Americans lead lives of independence, dignity, and purpose. She founded the National Retired Teachers Association, NRTA, in 1947, and later AARP in 1958. Caregiving is in AARP's DNA. AARP supports family caregivers and their loved ones, both directly through programs and online resources, and more indirectly through state and federal advocacy. So today we are going to share practical information to help you care for your loved one while also best caring for yourself. We'll break this down into 5 steps. Start the conversation, form your team, make a plan, find support, and care for yourself. Step 1, start the conversation. Often families avoid discussions about the future simply because they don't want to think about changes in the lives of the people they love most. Many people will wait until a crisis occurs before they talk about their values and preferences, wishes for healthcare, or details about their finances. It is never easy to bring up what you think will be an uncomfortable topic. However, a lot of uncertainty can be avoided if you talk with your loved one before a crisis occurs. It is easy to put off these conversations because they can be difficult. Plus, we are busy. But you may be surprised to find out that your loved one has been meaning to have the talk too. Before you start the conversation, here are some things to consider. Look for an opening. When raising the topic of future care, you might find it helpful to reference an article you just read or something you saw on the news to break the ice. For example, "I'm starting to think about estate planning. Do you have any advice?" Or, "I just read an article about gathering all your important papers. Sometimes can you show me where yours are and what you like us to do just in case?" Try not to anticipate what your loved one might say or how they will react. Just get the conversation started. Be open, express your love and concern, and most importantly, listen. Keep in mind that the conversation will likely take place over time. Respect your loved one's wishes. Make sure your loved one is participating in the conversation as much as possible. It's important to center your caregiving plan on the wishes of the person receiving the care. Like, where do they want to live, or how do they want to handle their finances? Size up the situation. Once you get the conversation going, evaluate what you're hearing. Understanding your loved one's priorities, like where they want to live and the nature of their care, will help determine the next steps. Money can be a particularly sensitive subject to talk about, but it is often at the heart of many decisions you'll make with your loved one. You need to consider how you're going to pay for housing, healthcare, and other expenses like groceries, medication, transportation, etc. Ask your loved one to review their bank accounts, investments, insurance coverage, and other relevant finances like assets or income that can be used to cover their costs. Find out whether they have long-term care insurance should they need it. To help you with these tasks, AARP has created the AARP Caregiving Financial Workbook, a practical guide focused on health, housing, and money management for family caregivers. Each set of worksheets is designed for caregivers to capture the essential information they need to manage the complex responsibilities of caregiving. There is also a workbook available specific to veteran and military family caregivers. You may find that your loved one's initial responsibility to your attempt to start the conversation is something like, "I just don't want to talk about it." Keep in mind that some people are private by nature. Sometimes it's difficult for someone to admit they need help, and as a result, you may encounter some resistance. If your first conversation doesn't go well, try again. If you're still running into difficulty, try asking a trusted friend, doctor, or faith leader to share your concerns. Does anyone have any suggestions or examples for starting these types of conversations? If so, please put them in the chat box.
Keisha, we have one comment so far, and that is that this individual watched the movie Still Alice with my parents, and it helped spark a conversation about their wishes, and it was very helpful.
Yeah, I totally agree. I got a chance to watch that before I was caring for my mom, and even after I was caring for my mom, and I learned a lot from it actually watching it. So that's a very, very, very good tip. Thanks for sharing that.
There's another comment saying, mark the date and do it. Can't say let's do it sometimes, that won't ever do.
Yeah, that is so true. Yes. Step 2, form your team. Caring for a family member or a friend can be too big of a job for one person. Trying to do everything yourself may lead to burnout and problems with your own health and well-being. It's important to form a larger network of family and friends and tap into community resources to share the load. Your loved one can help you identify willing team members such as neighbors or friends from the faith community that you may not have thought of otherwise. Look for team members who live nearby. Proximity has its advantages, such as stopping over to see your loved one, driving your loved one to a doctor's appointment, or cooking a meal. Just because someone doesn't live nearby or have huge blocks of free time doesn't mean they can't pitch in. Family or friends living at a distance can help with tasks such as coordinating meals, paying bills, or financial assistance. Look for team members who can help with simple tasks. Don't be hesitant to ask others to help. Some people may need a little encouragement to take on a task and are glad when you ask for help. Share their talents. Leverage the talents and strengths of your team. For example, the computer whiz in the family could set up an online calendar for coordinating meals or chores. And someone who loves the garden might be willing to help out with your loved one's yard. Your loved one can help identify team members, such as neighbors or friends from their faith community that you may not have considered. Here are some more considerations about building and supporting your team. Determine the number of team members. Both quantity and quality are important to think about when building your team. While having a large caregiving team can be helpful, too many people might be hard to manage. Make sure everyone on the team is clear about their responsibilities. They should be supportive and willing to lend a hand to you and your loved one. Next, assign roles and responsibilities. Everyone has something to contribute. Play to each person's strength and be clear on what's needed and expected. Then focus on the care recipient. The key and often looked participant in the conversation is the person who may need the care. Barring mental or physical incapacity or other extraordinary circumstances, the person receiving the care should play a significant role in determining who should be on the team and what needs to be done. Does anyone have any tips that they would like to share on forming a caregiving team? If so, please place them in the chat box.
Keisha, we have one comment saying, luckily my parents had 5 children, so we can split up some of the, whoops, screen rolled, sorry. We can split up some of the care, but since I live the closest, I'm the one who gets the brunt of it. But I insist that my siblings video chat with my mom daily, and that has been helpful.
Yeah, that's really good. I often talk to different individuals. In fact, I was just talking to someone the other day who is providing care for their mom, and their siblings are not joining in and they're not as helpful. So anytime you can have your family that's willing to team up, even though you have the primary caregiver, it's definitely helpful for the person that you're caring for and also for the primary caregiver. So thank you for that tip. Remember to support your team with your appreciation as well. This could be anything from a thank you card, a thank you note, or email to a quick phone call. Do ask for help when you need it. That is why you have a team. Ask those who live far away to regularly connect with your loved one by giving them a call, sending a card, emailing, or texting. And again, this is something that I know when I was caring for my mom. My mother is one of 13, and when individuals in the family would call her and check on her, as well as call on me and check on me, it was so helpful and it meant a lot. It meant a lot to both of us. Step 3, make a plan. Now that you have a team filled with willing caregivers, it's time to start building out a plan and designating responsibilities. Always make sure your plans are made with the person you are caring for at the center of the discussion. That plan doesn't have to be extensive or fancy. You can never anticipate every detail or scenario. The plan should include immediate needs as well as plans for the future. Keep in mind that the options for addressing needs will depend on the finances, the willingness of the support team, and the resources available in your community. A family or team meeting is one way to help you get things organized, ensure all of your team members are on the same page when it comes to making and keeping to the plan. First, meet with your caregiving team. This may take place face-to-face, over a conference call, or through a series of emails. Determine what works best for all of you. Set up a system for future communications with the team. Next, assess the goals and the need of your caregiving plan. Remember, this doesn't have to be expensive or fancy, as you can't anticipate every detail or scenario. Just try to include immediate needs and broader plans for the future. After you determine your goals, delegate responsibilities. It's time to figure out who will do what. Make sure you determine what task everyone is comfortable performing. Also be sure to ask your team members about their preferences. Be open to modifications as the situation and team members' ability to help may change. How your loved one's needs unfold may differ from what you anticipated. Here are some helpful tips to remember during your team meeting. The team member who will receive the care should play a significant role in talking about the assigning roles and tasks to the extent possible. For example, even if one child is an accountant, an older parent may feel more comfortable having another child look after their financial affairs. Communicate. Try to keep everyone informed as things change. Make sure that everyone knows about the discussion ahead of time so that there are no surprises or hurt feelings. One team member should take notes and write a brief summary of what was decided. A written summary of the plan helps ensure that the wishes and needs of the loved one has been considered and included. Does anyone have any tips on making a plan? If so, please put them in the chat.
Keisha, I have one comment in the chat box so far saying having my mother's primary care doctor talk to her about the need for a plan. And that was helpful because she's from the generation that listens to doctors and not to Google. Also, delegating has been helpful. And Keisha, in my own situation, I have been a caregiver both to my husband, both of my parents, and my husband's father at one point in time. I found that I got more support from my friends and my neighbors than I did from family members. So don't forget to expand your view as far as those individuals who may be willing to help.
Yeah, really great suggestions. And I know when I was caring for my mom, I did both of those. I brought in the neighbors, church friends, and to build a plan. I had a journal where I put down different things of from what time to give her medicine to what did she like to watch on television, what channel it was on, what not to say to her, what would trigger her to make her get upset. And so all of this, by building a plan, it really can help the person that you're caring for and take some of the burden or the stress, I should say, off of the person that's providing the care, because sometimes we get a little worried when we have to leave our care of the person that we're caring for in the hands of others. So thanks for the suggestions, really good. Step 4, find support. If you've come to realize that the scope of care needed for your loved one is beyond what you or your team can provide, it's okay to reach out for extra support. There are many types of community resources that may be available to provide support. Your local area agency on aging can help connect you to a variety of support services, such as home delivered meals, transportation, adult daycare, care management, and more. Your local area agency on aging can also answer questions about which resources are free and which may have a cost. You also can check into services offered in your community through the Elder Care Locator. The Elder Care Locator is a public service of the U.S. on Aging Administration. It connects caregivers to local services and support. Any of the resources I mentioned today are in the Prepare to Care guide. You can also consult a professional. Oftentimes, your loved one's need can be complex, especially when health, emotional, and financial issues are at play. A trained social worker or nurse can help you sort things out, determine what is needed, find services, and arrange care. Again, the Elder Care Locator is a great resource to find such professionals. I encourage you to highlight this resource in your book, and don't forget to ask your employer if they offer an employee assistance program. This can connect you to professionals and other services in your community. Teams often need outside support. Here are ideals about some of the most common needs. Hire help. If you see that your loved ones needs help with daily activities, try exploring home care options. Some home care workers do household tasks such as cleaning and meal preparation, while others do more personal care tasks such as bathing and dressing. Your local area agency on aging can help you identify and connect with the appropriate services. You can also go online and visit AARP's Caregiving Resource Center. That's aarp.org/caregiving for more information. Secure their safety. To help you and your loved one be safe and comfortable in their home, try incorporating handrails, grab bars, night lights, or adjustable shower seats. Some things such as installing grab bars may be best to be installed by a professional. You can also check out AARP's Home Fit Guide at AARP/HomeFit for a whole range of solutions. The guide provides tips, suggestions, worksheets, and resources to make a home a lifelong home. Explore housing options. A variety of housing with supportive services may be available in your community. Begin by making a list of criteria such as location, group dining, laundry service, and more. Once you determine the criteria you need, visit several facilities and be sure to talk to residents and their families. Support groups can also be helpful in navigating available resources. AARP has a Facebook group for caregivers. You will see a link to it in the chat. Does anyone have any tips to share about finding support? If so, please place them in the chat box.
Keisha, I have two comments.
Mhm.
One is that someone used the local area agency on aging to get resources. They were wonderful. And also the Parkinson's support group was very helpful. I myself use the support groups available through the National Multiple Sclerosis Society that I found lots of information there as well. Don't assume that your loved one will always get quality care in a rehab center, hospital, or nursing home. Advocate for your loved one. You and your team need to be a constant presence.
Yeah. For me, being in the military, I was in the military when I was caring for my mom. And so I was able to get a lot of support through the VA, connecting with others in the military, and they were able to provide a lot of support. So the VA is a very, very big help for the military. And I also was able to connect with my homeowners association and find different people in my neighborhood that had specific skills that I had not even thought about. So that was very, very helpful as well. So while you're finding support, also just talk to other caregivers. Visit a senior center and ask about resources in your area. You can always use the internet to explore options. And make sure when you do that, you read the reviews. And as I mentioned, connect with other caregivers. Step 5, care for yourself. I absolutely love this step. Don't overlook the impact of caring for yourself. Pay attention to your health and well-being. The best way to ensure you have the energy to care for a loved one is to take care of yourself. Here are some tips for caring for yourself. Tap into resources. Social workers, nurses, and other professionals can guide you through care options and help monitor the care if you don't live nearby. Use technology. Personal emergency response systems, remote monitoring devices, and mobile apps can help you coordinate care. Ask your employer. Some employers offer benefits or services to support family caregivers. Review finances. It's important to calculate your caregiving related expenses and account for them in your personal budget. Here are some additional tips for caring for yourself. Talk to your doctor. Let them know that you are a caregiver and discuss ways to manage stress. Advocate for you. The Caregiver Advise, Record, Enable, Care Act has passed in many states. You should consult with your loved one's doctor for training if you are expected to do complex medical tasks at home. Take advantage of caregiving services and support. Services and support groups can help you throughout your caregiving journey. And never forget to take a break. Make time for exercise, sleep, healthy eating, and staying connected with others. Does anyone have any suggestions they'd like to share about taking care of themselves during their caregiving experience?
Keisha, we have one comment so far saying, don't be afraid to recognize your grief and seek the services of counseling professionals to work through the grieving process. Someone else just hired help to take a few hours a week off to go to the library or the bookstore. One of the ways that I used to care for myself, and actually I still do it, is to, turn the music up and dance like nobody's watching. And when I'm not got the music up loud and dancing, some meditative music or meditation videos or things that are available on public access TV was helpful to me during those times.
Yeah, I totally agree with the music. I love the music. It was one of the things that was able to help me to just be calm and to relax at times when things were very, very stressful and things were very intense. So yeah, and I was talking to someone the other day about who was caring for their mom, and she was mentioning that her mom was saying some kind of things that just weren't really nice to her. And I was telling her if she had some ear pods or earbuds, just to pop them in her ear, and that way she can listen to what she wanted to listen to and not necessarily hear some of those things that her mother might have been saying that weren't so nice. But at the same time, she didn't have it up so loud that she still couldn't hear and be available to help take care of her mother when she needed to. So
Keisha, let me share one other comment that came in because it's a good one. And that is that AARP has been awesome in offering exercise classes, which helps me with everyday stress.
yeah.
Someone else practices mindfulness, meditation, etc. And someone else has hired someone to come in for 4 hours on Monday through Friday. So our sister, the primary caregiver, could go to exercise and meet with friends.
Yeah.
All excellent advice. Thank you for sharing.
Yes, really, really great advice. In addition, just, take a night off for yourself. And again, we know it's very difficult to do that, but it's something we have to intentionally try to see if we can fit that time in, and having someone to come in and sit to allow you to take a night off is really good. Meet up with friends, take time for yourself. Even a short walk can help, or maybe just curl up with a great book or get a manicure or a massage. AARP offers a variety of online information resources in-person events, and self-paced learning for family caregivers. I want to be sure to mention several resources. AARP's Caregiving Resource Center, which is a central hub for all things caregiving at AARP. Read the latest articles, tips, and advice. That's where you'll also find the Prepare to Care guide with downloadable checklists for when you need to update or revise your caregiving plan. A copy of the Prepare to Care guide, you'll also receive a copy of it in the mail. In addition, there is a toll-free resource line. You can call 1-877-333-5885. Again, that number is 1-877-333-5885. In Spanish, you can call 1-888-971-2013. Again, that is 1-888-971-2013. The hotline is open Monday through Friday, 7 a.m. to 11 p.m. Eastern Time, and Saturdays, 9 a.m. to 5 p.m. Eastern Time. The telephone number is also on the back of your Prepare to Care guide. Community Resource Finder. Get easy access to resources, community programs, and services through this online community resource directory. The directory is compiled from provider descriptions and public data and made possible by the Alzheimer's Association and AARP. There's also learn.aarp.org. You can visit this site to learn about upcoming events and to explore interactive educational videos and webinars on caregiving. Again, that is learn.aarp.org. I would also like to remind you that your Prepare to Care guide has a variety of resources, including your local area agency on aging and the elder care locator in the back of the book. I hope you enjoyed today's Prepare to Care presentation. We've covered a lot, including learning 5 steps to create a caregiving plan, which are: start the conversation, form your team, make a plan, find support, and care for yourself. Now, me being in the military, we had to learn a lot of acronyms. So for the SFMFC, I always say, when I'm telling people about this, I call it strategies or suggestions for making family caregivers. We also shared many ideals and resources available today. To continue your learning on this topic, make sure you check out AARP's caregiving resources in the Prepare to Care guide. And we hope you stay connected with AARP. Thank you for your time today.
Keisha, that was great and very informative. Thank you so much. If you have questions for Keisha, please put them in the Q&A box. We have one more speaker for you. So if you have questions for Keisha or for our next speaker, please put them in the Q&A and we will get to as many questions as we have time for at the end of our presentation. And now I'm pleased to be joined this morning by Nakia Speller from the Prince William County Area Agency on Aging, where she is the Supportive Services Division Manager. As the Supportive Services Division Manager, Nakia manages departments that work to provide services, resources, outreach, and advocacy to older adults and adults with disabilities throughout a tri-jurisdictional area. Nakia has spent the last decade working to empower older and disabled adults, as well as other vulnerable populations and their families. This morning, Nakia will share with us information about resources and programs that are available to family caregivers. So please give a warm welcome to Nakia.
Good morning, everyone. Thank you so much for being here. I am extremely excited to be here and honored that I get to share some of the services and programs that I represent with my agency with you guys. I was taking notes at some of the things you guys are doing and caring for your loved ones and also yourself. As Trudy said, my name is Nakia Speller, and I am the Supportive Services Division Manager for the Prince William Area Agency on Aging. We are a tri-jurisdictional agency, which means we cover not only Prince William County, but also the city of Manassas and Manassas Park. I did hear somebody say that they had worked with their area agency on aging, so I'm not sure if it was ours or not, but I hope it was. And if you did, I hope you had a really good experience with us. As Trudy also mentioned, my job as the Supportive Services Division Manager is to oversee and manage programs that our agency directly provides to caregivers, also older adults and adults with disabilities in our area. The other thing that I have the pleasure of being able to do is to also coordinate and collaborate with other local agencies, such as the Department of Social Services that some of you may be familiar with or have even tried to get services through them. Also, our local health department. We work hand in hand with those agencies on a daily basis to get services and programs and resources to the older adults and disabled adults in our area. The other thing about that is I get the honor of working with other local and nonprofit agencies that provide services and resources for our agency. I know Keisha in her presentation mentioned contacting our agency with questions about what services and resources may be available in the area. And I'm gonna introduce some of those later on in my talk with you. The way that we're able to do that is through collaborating and coordinating with all of the local and the nonprofit agencies in our Prince William County service area is through a system that we call No Wrong Door. The premise being that no matter what entry point you come into, whether it's at contacting our agency directly or at the Department of Social Services or maybe the health department, that you are going to get connected to the agency, the program, the service or the resource that you need. One of the ways that we do that is by having trained and certified individuals in our agency called information and referral specialists. When you contact our agency, whether it's by phone, and I'll give you that number, 703-792-6374. The presentation that's here will have our phone number and also our website listed so that if you want to contact us directly, you will have that information to do so. Our information and referral specialists are trained and certified and knowledgeable of not only the resources and services that we have in Prince William County, but also the surrounding area. And so they're able to provide you with some of those services as well. I see is Trudy trying to get to, yep, that's it. Our intake line is what we call it. And so when you contact our agency, you will be speaking with one of our certified information and referral specialists. Some of the services that we offer, and when you contact our agency, whether it's via phone or if you contact us via website, you'll be able to look at what some of the services are that our agency provide. Even if we don't provide a service directly, meaning our agency actually provides the employees or carry out that particular service or resource, we will definitely be able to get you connected. We do use the Elder Link. We use 211. So all of the resources that are at our disposal, we are looking at that to be able to provide a holistic approach to working with you and your loved one to find the right service for you. Some of the services that our agency provide are personal care services. So personal care services are those in-home services such as bathing, meal prep, laundry, light housekeeping things. We are able to provide those services through our personal care program. If you contact our agency, you're going to ask for, hey, you might not even know what particular thing you want to ask for. If you just call and let us know that I'm looking for someone to help me a few hours in the home so that I can go out and take a walk or read a book or go to Starbucks like I like to do during my lunch break sometimes, then we'll be able to assess you and to see if your loved one is qualified for that particular service. The other service that a lot of people know our agency for is, of course, our home delivered meals or our Meals on Wheels program. Those programs are available for individuals who are homebound and unable to prepare a nutritious and healthy meal for themselves. I like to add that during the pandemic and the shutdown, our agency never took a day off. We actually still ran all of our programs, whether they were virtually. For us, our particular agency during the pandemic, we still continued to serve over 2,500 meals a month for homebound seniors through our Meals on Wheels program. So we have continued to do that. We also understand how important it is for our volunteers with our Meals on Wheels program. Not only is it just delivering that nutritious meal, but also that one-on-one connection and contact with the volunteer dropping off the meal. Even if it was only for 5 or 10 minutes a day, that was still some very good quality time for that homebound senior or individual to be able to talk with the volunteer. Sometimes if the volunteer that was delivering the meal sensed that something wasn't right, they called us back and let us know, and we were able to send social workers out to the home to be able to talk to the person to see if Meals on Wheels was enough for them or if they needed additional services in the home. We also have a Medicare counseling program that we have a trained specialist in our agency that works through those questions. Medicare can be extremely confusing for a lot of individuals, but we have somebody on staff that's able to talk with you and walk you through what those what the Medicare can do for you. We also partner with a local nonprofit to do a telephone reassurance program. That is extremely important, we found out over the years. For some people, caregivers who are back at work or when they are out of the home for some respite time of their own, it's just to have somebody contact their loved one to check in. Hey, how are you doing? Sometimes they just want somebody to have a friendly visitor to talk on the phone with them. We do the telephone reassurance, does medication checks, had check-ins, not checks, check-ins. Have you taken your medication today? Have you talked to your family today? So having that connectedness is very important through that telephone reassurance program. We also operate 2 senior centers in Prince William. One is on the east side in Woodbridge, and the other one is in the western part of the county in Manassas. Those senior centers offer congregate meals. Now that we've reopened post-pandemic, I think we opened back up July the 1st. And so we're open Monday through Friday from 9 until 4. You can go there and have a congregate meal, so meet with some of your friends. They also offer several activities that people can participate in throughout the day. The first day of reopening, I went around to all of the facilities. There were lines out the door waiting for their chance to come into the facility again. That also let us know that the connectedness to seeing your friends, family members, just being able to congregate back again so that you can talk about what's going on. We know that just the ability to be able to talk with your friends can be healing, just to be able to share what's been going on. So I remember walking to both centers, and there was a line in the parking lot because they were so excited and ready to get back to their old friends. The other facility that we operate is our adult day healthcare program. This program is available for individuals who have cognitive impairments. So these are individuals, whether they have dementia or Alzheimer's. Our facility provides nutritional meals and snacks every single day. It is a locked facility, so they can't just come and leave. They have structured, it's a structured setting, and they also have scheduled recreational activities. One of the things that I'm proud to say is that our ADHC, or the Adult Day Healthcare Center, received a national award through N4A on a program that they started pre-COVID. It's almost like we're saying pre-COVID and post-COVID. That's how we're referring to things. What they did was, a few years ago, the federal government stated that we needed to be able to still provide activities for individuals, regardless of their abilities, the same opportunities for meaningful activities. And so one of the things that they did was they created an internal, the word that's coming to mind is caucus, among the participants in the facility, and asked them what they wanted to do. The consensus was that they wanted to take field trips. So that's what we went to work in doing, is finding a way that we could provide them with outside activities, outside of the center activities. And they were able to do that. I think they were able to go on about 2 to 3 field trips or outings. One was to a restaurant to have lunch. One was to their local library to pick out books. And one was for a nature walk, not too far from the center. And they definitely enjoyed that. And once we had the opportunity to write that activity up and present it, they received the national award. So we're proud of that. And not only just for us doing it, but we actually listened to the participants, understanding that having cognitive impairment still did not take away that the person was still there and they still had their own wants and needs. So we're proud of that. I did mention that once you contact our agency, again, the number is 703-792-6374, you'll speak with one of our trained and certified information and referral specialists. Once you want to know about a particular program and you have questions about it, they will get some information from you. Sometimes they're able to give you the information over the phone without having to do any type of assessment. But you do have the option that when your needs or the needs of your caregiver, the loved one, supersedes just a phone number. Hey, what's the phone number to, I need a plumber for my house. What else can I get? Or if I am interested in that personal care program or the adult day healthcare center that you operate, how do I go about getting my loved one in? What that information and referral specialist will do is get some information from you and then refer you on to one of our supportive services specialists. These are also trained individuals, master's level individuals who work with our programs. Once they find out what it is that you want, they work with you on determining what those options are for you. After that, we make sure that you will receive a comprehensive assessment to make sure that you qualify for whatever program that you're interested in. So those are just a few of the services that we provide. If you have any additional questions, again, contact our information and referral, our intake line. You have our website here. Feel free to give us a call. We are waiting, and we want to get you connected to not only the services that we provide, but other services that might be available for you and your loved ones in our community. Thank you so much.
Very good. Nakia, thank you so much. We do have a couple of questions, so I'm going to ask Keisha if she can come back in case she's the better person to answer these questions. I think the first one is probably going to be directed to Nakia. Would I be correct in saying that, because we have a couple of people joining us from outside of Virginia, within each state and within each county, there should be a local area Agency on Aging. So if someone is looking for that in their own backyard, could they just use their favorite search engine, type in their county and area agency on aging? I always stumble over that and I apologize. Their county and area agency on aging to find the resources that are in their backyard. Is that correct?
Absolutely. Thank you for bringing that up, Trudy. Great question. Yes. There are we call them AAA. So if Area Agency on Aging trips everybody up, because it does, we just say AAA. They are located in all 50 states. So you should be able to exactly type it into your search engine, pull up where you are, your county, and be directed to that, to your local AAA.
Okay. I have another question, and that refers to the cost of Meals on Wheels or home delivered meals and the cost of getting in-home personal care. Where would one go to find those resources?
If they are in Prince William County, then they contacted us. They will contact us and we could give them the information. It'll be a mini screening where they ask questions. There's criteria that they have to meet. These criteria are set by the Older Americans Act. So some of these programs that we operate are funded through the Older Americans Act. Those programs in and of itself, for our personal care program and our home delivered meals, there is not a cost for the service. Doesn't mean it doesn't cost. There is no cost. However, we ask for contributions if you're able to do that, and that'll be in the PowerPoint presentation as well. However, if someone is unable to contribute to the cost of the meal or the service, they do not ever start receiving that service for the inability to contribute.
Very good. That I'm just double checking to see if any questions showed up in the chat room. One final question, and that is, how can I hire affordable home health aid? My mouth is not working this morning and I apologize. Okay. I think you know what I'm asking. Okay.
So how can they hire affordable home health care?
Yes.
Workers to go into their homes. So when you contact our agency, if you do not qualify for our personal care program, meaning the person's needs are more extensive than what our program provides, we also have a care registry. And so what we do is we have individuals, they are not hired by us, but we have a list of contracted people that provide that service. And normally what they will do is find out what the needs of the families are and work to come to a price that's suitable for the family. We know that costs can be astronomical when it comes to providing in-home care for families.
Excellent. Very good. That looks like all the questions that I have for both of you today. So with that, I will say on behalf of AARP Virginia, I'd like to thank both of you for sharing your expertise and your information with us this morning. And thank all of you, our guests in the audience, for joining us this morning. We'd like to get your feedback on our program. So in the chat box, you'll see a link to a survey. Please click on that link and take a few moments to share your feedback with us. We will also be sending you a follow-up email. If you've enjoyed this program and want to join us again, we will be offering it again on Wednesday, September 29th at 7 p.m. We invite you to join us for this program and many of our other programs as well. You can see a full calendar of our events at www.aarp.org/virtual VA. Until next time, take good care of yourself and those you love, and AARP will continue to help seniors live independently and for the family caregivers who make it possible for them to stay in their homes. Thank you for joining us today. We look forward to seeing you again someday soon. Thanks. Bye.